Officials are now encouraging the use of monoclonal antibodies to treat people who are diagnosed with COVID-19. But some people may still have questions about what exactly the treatment is and how it might be beneficial. Valley News Team's Nishay Taylor spoke with an infectious disease expert to learn more.
Currently, there are a couple of monoclonal antibody infusions available for emergency use under the guidance of the Food and Drug Administration. But what are monoclonal antibodies?
The primary purpose of these antibodies is twofold. One is to use them as a treatment. So if you get COVID-19 infection and you are in the high risk category to get into complications of COVID-19 infection, we try to administer these antibodies within the first 10 days of symptom onset.
The antibodies are also used to prevent infection after exposure for high risk populations, like in nursing facilities that have had a COVID-19 virus outbreak. And as a virus surge is redeveloping due to the Delta variant, health experts are encouraging the use of these antibodies to help limit the number of hospitalizations.
Hospitals are running at full capacity, and we are trying our best to blunt the surge or at least prevent as many hospitalizations and deaths as possible. So we are working overtime, and we are infusing about 15 to 20 of these antibodies on a daily basis in hope to keep these patients out of the hospital and prevent any complications.
Sanford's Dr. Avish Nagpal says the COVID vaccine is the most effective way to prevent the virus, as it is something that's immediately available rather than being required to test positive for the virus in order to receive the monoclonal treatment. He also says these antibodies are not 100% effective. In Fargo, Nishay Taylor, Valley News Live.
A member of Altru's pharmacy team in Grand Forks is crediting monoclonal antibodies for saving his life. We'll bring you his story tomorrow right here on Valley News Live.